Hi, my name is Jennifer Youngblood. I'm a health educator with the Health and Preventive Services team with Optima Health. Today I'm excited to bring you a brief presentation on hypertension, which is also known as high blood pressure. According to the American Heart Association, high blood pressure, also known as HBP or hypertension, is when your blood pressure, the force of blood flowing through your blood vessels, is consistently too high. In order to survive and function properly, your tissues and organs need the oxygenated blood that your circulatory system carries throughout your body. When the heart beats, it creates pressure that pushes blood through a network of tube-shaped blood vessels, which include your veins, arteries, and capillaries. This pressure, called the blood pressure, is the result of two forces. The first force, or your systolic pressure, occurs as the blood pumps out of the heart and into the arteries that are a part of the circulatory system. The second force, the diastolic pressure, is created as the heart rests between heartbeats. Your blood pressure is recorded as two numbers. Systolic blood pressure, the first number, some refer to as the top number, indicates how much pressure your blood is exerting against your artery walls when the heart beats. The diastolic blood pressure, the second number, or the bottom number, indicates how much pressure your blood is exerting against your artery walls while the heart is resting between beats. Which number of my blood pressure is more important? Typically, more attention is given to the top number, or the systolic blood pressure, because it's a major risk factor for cardiovascular disease for people over age 50. In most people, the systolic blood pressure rises steadily with age due to increasing stiffness of the arteries, long-term buildup of plaque, and an increased incidence of cardiac and vascular disease. However, either an elevated systolic or an elevated diastolic blood pressure may be used to make a diagnosis of high blood pressure. The 5 blood pressure ranges as recognized by the American Heart Association are normal blood pressures, which are numbers less than 120/80, and they are considered within the normal range. If your results fall into this category, you want to stick with heart-healthy habits like following a well-balanced diet and getting regular exercise. Hypertension stage 1 is when readings consistently range from 120 to 129 systolic and less than 80 diastolic. People with elevated blood pressure are likely to develop high blood pressure unless steps are taken to control the condition. Hypertension stage 1 is when the blood pressure consistently ranges from 130 to 139 systolic or 80 to 89 diastolic. At this stage of blood pressure, doctors are likely to prescribe lifestyle changes and may consider adding blood pressure medications depending on your cardiovascular risk, such as heart attack and stroke. Hypertension stage 2 is when blood pressure consistently ranges at 140/90 or higher. At this stage of high blood pressure, doctors are likely to prescribe a combination of medications as well as lifestyle changes. Hypertensive crisis. This stage of blood pressure requires medical attention. If your blood pressure readings suddenly exceed 180/120, you want to wait about 5 minutes and recheck that blood pressure. If you are still running above 180/120, you want to contact your doctor immediately, as you could be experiencing a hypertensive crisis. If your blood pressure is higher than 180/120 and you are experiencing any signs of possible organ damage such as chest pain, shortness of breath, back pain, or any numbness or weakness, change in vision or difficulty speaking, do not wait to see if your blood pressure comes down. You want to call 911 immediately. The only way to know if you have high blood pressure is to have your blood pressure checked by a healthcare professional. Understanding your results is necessary to control your blood pressure. It's important to know what is considered normal as recommended by the American Heart Association. If you have been diagnosed with high blood pressure, there are changes you can make to manage it. Number 1, eat a well-balanced diet that's low in salt. Number 2, limit your alcohol. Number 3, enjoy regular physical activity. 4, manage stress. 5, maintain a healthy weight. 6, quit smoking. Number 7, take your medication properly. And number 8, work together with your doctor. Managing your blood pressure is a lifelong commitment. If you do have high blood pressure, it's vital that you listen to your doctor. And remember, you are a part of your healthcare team. You and your doctor are partners. That concludes my presentation today on hypertension. For more information on today's topic, check out the American Heart Association as well as the Optima Health websites. Thank you for watching and have a wonderful day.